Hello there. I'm Emily. I'm going to be your student physical therapist today. Do you mind confirming your name and date of birth for me?
Yeah, I'm Ashley Payon. My birthday is July 3rd, 1997.
All right, wonderful. So what brings you into physical therapy today?
I've been having some pain in my left knee lately. It's really painful.
Really painful?
Yeah.
Where does the pain stay at your knee, or does it, spread anywhere else?
It mostly stays at my knee. Doesn't really go up or down my leg at all.
All right. And now on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain you've ever felt in your life, how would you rate the pain?
I'd say it's about a 5.
About a 5?
Yeah.
All right. And can you describe the pain for me? So you said it doesn't spread, but do you feel like it's throbbing, tingling, sharp, burning?
It's a little sharp sometimes when I put pressure on it when I'm walking. But it's mostly just stiff. It's really hard to move.
Just stiff?
Yeah.
Okay. And then do you remember how this pain came about? Did something happen that brought about the pain?
No, it just kind of started hurting about a month ago.
A month ago?
Yeah.
Okay. Are there certain things that you do that make it worse?
Not really. I do play tennis, so sometimes when I'm playing tennis it hurts, but like I said, it just kind of came out of nowhere and started hurting.
Okay. So then on the flip side, is there anything that you do that makes it feel better?
Yes, I tend to rest and not play as much tennis, and yeah, it's mostly just rest.
So just resting.
Yeah.
Are there any medicines that you take for the pain?
Yeah, it's this one starts with a C, Ceralac, Cerabrex, something like that.
Okay,
yeah.
something along
Sorry,
those lines.
I can't remember.
No, you're okay. You're okay.
But I know it's for pain.
It's for pain. Okay. How often do you take it?
Just when needed, when there's pain.
Just when needed.
Yeah.
So as of lately.
As of lately, mostly 2 times a day.
2 times a day.
If I'm really active, if I'm resting it, maybe just once. But really 2 times a day.
All right. So do you feel like this pain, so you said that you play tennis, do you feel like it affects anything else that you do on a day-to-day basis?
Going up and down stairs, it hurts a little bit there. Yeah, I'd say that.
Up and down stairs. So stairs, outside of your home, or are there stairs in your home?
There's a few stairs outside my home, and then I do live in a 2-story house, so I do have to go up and down stairs for that.
Okay. So how many stairs leading into your home?
2.
2. And then could you give me an estimate on how many stairs to get to the second floor?
About 12, I would say.
12?
Yeah.
Okay. And also another question that I have would be, have you had any blood work done recently?
No, but I did have an x-ray done. But it was from my past knee.
So this one?
Right,
The right
yes,
one?
yes, right.
Okay. So when was that x-ray done?
A while ago, I can't remember exactly, but I had it done because I ended up having a total knee replacement.
Total knee replacement,
Yeah.
okay.
They told me I had osteoporosis.
Okay. So osteoporosis in the right, and then total knee. Would you say it was recently the surgery, or was it?
No, it was in 2007. I just don't remember when I had the x-ray, but yeah, 2007 is when I had the surgery.
Surgery, okay. Okay. So, going off of that, is there a history of osteoporosis in your family?
No.
Or any other medical history related to your family that I should know about?
My brother has diabetes. My dad had a stroke, but they haven't really had any bone problems.
Okay.
Yeah.
Good to know. So now transitioning into your home environment. So you said that you have a 2-story home. Does anyone else live with you?
Yeah, my husband.
Your husband? All right. And are there any handrails for the staircases going into or up to the second
Not
story?
outside my home, but my staircase, there's a railing on the one side and then the wall.
Okay, so the railing inside the home. Okay. So, moving on from that, you mentioned earlier tennis. So are there any other hobbies that you're interested in? Anything else you like to do?
I just like to stay active, working out, but mostly tennis. I play about 3 times a week, so that keeps me pretty active, I'd say.
Yeah, sounds like it. And with tennis, is it just you meet up with people at the club, or?
Yeah, a few friends of mine, we get together.
Okay, that sounds fun.
Yeah, it is a lot of fun.
All right. right, so going off of that, what would you consider your overall health to be on like a scale of like excellent, fair, or poor?
I'd say pretty good.
Mhm.
I like to eat healthy, the occasional sweets, of course. You know,
Yeah.
always sweet tooth there.
Always hard.
And working out with tennis and stuff. So I stay pretty active, and I'd say I eat relatively well. So I'd say pretty good overall.
Okay. So now I just have a few questions, just to go through really quick.
Okay.
So, do you smoke?
No.
Do you drink alcohol?
No.
Do you drink caffeinated beverages?
I do.
All right. How often do you drink those?
In the morning, my coffee, the regular coffee.
Yeah,
Mhm.
I agree with you there. So, would you say it's about once a day for the caffeinated coffee?
Yeah, about once a day.
Okay.
Not really a soda drinker, so just mostly the coffee in the morning.
All right. Sounds good.
Mhm.
So, before we finish up, relating back to your total knee replacement, what are your thoughts about your new pain in the left knee? Do you feel like it's similar to what you experienced with the right?
Pretty similar. I'm just trying, hopefully, to not have surgery on the left leg like I did the right.
Okay.
So that's like my main goal with that.
Okay, so
yeah,
your main goal is to not have surgery
Yeah.
in the left.
if possible,
Got it.
but prepared.
Did you have PT after the surgery on the right?
I did.
Okay.
It helped a lot. So
So now we're coming back, hoping.
yeah, hoping we can prevent it.
All right. Okay, so that's good to know. And now I'm just going to go through a list of like some standardized questions that I need to ask, and you just try to answer them as best to your ability.
Okay.
So has there been any unexplained weight loss or weight gain?
Now that you mention it, I have had some weight gain.
Some weight
recently,
gain
Yeah.
recently? Okay. And have you talked to your doctor, or have you seen your doctor since the weight gain
Not
has occurred?
since that.
Okay.
No, I haven't.
All right. So considering, with how healthy you are, and your habits and all of that, I'd say the next time you go to see your primary care physician, I would suggest that you mention that to him
Okay.
or to them if they don't notice,
Okay.
just to, be on the safe side. Okay, so any fever, chills, or sweating?
No.
Any nausea, vomiting, or loss of appetite?
No.
Dizziness, lightheadedness, or falls?
Mm-mm.
Fatigue?
Nope.
Weakness?
Nope.
Any numbness or tingling anywhere?
Mm-mm.
An uneasy sense of body discomfort lately?
No.
Right. And then any changes in your ability to like remember things or understand what's going on?
No.
Okay. And have you had any headaches lately?
No.
Any blurry vision?
Mm-mm.
Loss of hearing?
Nope.
Sensation or changes in taste sensations?
Nope.
Any differences with smelling things?
Nope.
Swallowing, is that normal?
Yeah, it seems normal. I'm still able to eat. So.
Yeah, that's good. Enjoy your sweets.
Right.
Any like indigestion or abdominal pain?
No.
Any like heartburn after eating?
Mm-mm.
Any weakness or pain in like your joints?
Mainly just my left knee, but my right one's fine.
Okay. And then any swelling going on?
A little bit on my left.
On the
knee.
left?
Yeah.
Okay. Right. So now that we've gone through all those fun questions, I'm just gonna do check your vitals really quick. So is that okay?
Yeah, that's fine.
All right. So the first one I'm gonna do is gonna be this one right here. I'm gonna put that on your index finger. Thank you very much. If you want to relax that, we'll just go ahead and let it do its thing. And what it's going to tell me is your oxygen saturation level, so just making sure that the amount of oxygen in your body is normal. Yep, so your oxygen is at 99%, which is in the normal range, so that's very good to see. And now the next thing I'm going to do is just check your heart rate. So I'll go ahead, test it on this one, and I'll do that for like about a minute. heart rate at about 62 beats per minute, which is within the normal range. And along with that, I was checking your respiratory rate, and you were breathing about 13 breaths a minute, which is also within the normal range. So that's good to see. So next thing we're gonna do is I'm gonna take your blood pressure. So first thing I'm gonna do is try to find a good old pulse right here. Yep, got a good one. All right, so go ahead and just place that on there. Okay. All right, so now if you could just rest your arm in mine. Go ahead and relax. Ooh, this is gonna be fun. All right, ready? All right, so I got your blood pressure at 108/70. Is that normal for you?
Yeah, pretty normal. Normally like 110, but yeah.
Okay. Sounds good. And the last thing I need to do is just check for swelling right around your feet. So if you don't mind taking your shoes off for me. Thank you very much. So I'm just going to press down on the skin right here. All right. All right, so your skin bounces back quickly after I press down on it, so that's normal, so that's good. And if you don't mind putting your shoes back on for me. The next thing we're gonna do is just walk around, so I'm just gonna put this belt on for safety, is that okay?
Yep.
All right, so if I can have you lift your arms up for me. Just gonna put this around your waist. So we can be safe. And I'll tuck it under here so it's out of the way. All right. So what we're gonna be doing is walking through the clinic for a little bit. What I'm gonna have you do is stand up for me, and then we're gonna walk over to the wall, and then we'll go ahead and sit up on that table. Sound good? So whenever you're ready, you can go ahead and stand up. I'm gonna take these on with me. How are we feeling?
Pretty good.
Any pain?
Just a little bit when I step up on it, but
Otherwise,
otherwise,
pretty normal.
yeah.
Okay. You can go ahead and sit up. All right, so the next part of our evaluation is going to involve me screening just a range of motion of your legs and your ankles and your strength as well. So the first thing I'd like you to do is lift your thigh off of the table, this side first. Perfect. Now I'll go this way. All right. Now go ahead and test your strength. So if you don't mind lifting up just a little bit, I'm going to go ahead and push down. Don't let me break you. Okay, now I'll do the same thing on this side. Don't let me break you. Okay, next we're gonna move on to your knees. So for this one, can I have you extend your leg out? Perfect. And then same thing with this one, try to kick it as straight as possible. Okay. And then can you go ahead and try to, bring your heel to your bottom? Okay, now on the other side. Right. And now what I'm going to do is test the strength. So we'll start right here, and I'm going to try to push you down. Don't let me move you. Okay, I'll do the same thing from this side. Don't let me move you. Okay, and now we're going to start ourselves up this way. I'm going to try to push your leg out. Don't let me move you. Okay, and the same thing on this side. Don't let me move you. Okay, the next thing I'd like you to do is point your feet up towards the ceiling, toes.
Do I take my shoes off?
Yes, thank you.
Toes to the ceiling?
Yes, toes to the ceiling. And then go ahead and point them down to the ground. Okay. So now we're gonna set them up facing the ceiling, your toes, thank you. I'm gonna try to push down, don't let me move you. Same thing on this side, point to the sky, and don't let me move you. I'm gonna go ahead and point your toes to the ground. I'm gonna try to push up, don't let me move you. Okay, same thing on this side, don't let me move you. Okay, now I'm gonna have you point your toes toward each other. And now point them away from each other. Okay? So now if we set it up this way, I'm gonna try to push your foot out, don't let me move you. And then we'll set it like that, don't let me move you. Okay, same thing on this side, point in, don't let me move you. This way, don't let me move you. Alright, so we went through those motions, and now, since I'm here, I'm just gonna check your scar, make sure that it's looking good, and it looks pretty healthy, looks like it healed pretty well, so that's good. And besides the swelling over here, the skin around the knee that's affected also seems pretty healthy, intact, so that's good. So yeah, I'll go ahead and report my findings to my clinical advisor, and then the next time we see you, hopefully we can start on some exercises.
Perfect,
It was
sounds like a
very
plan.
nice meeting you,
Nice to meet
Ashley.
you too.